Welcome to today's Explainer. We're diving right into the ultimate biological engine of the human body, the heart. We aren't just going to look at it as some static organ on a page, we're really going to understand it as the body's ultimate powerhouse. It is just a brilliant piece of biological engineering, and by the end of this Explainer, you're going to see exactly how its structure is perfectly designed for its function. 100,000. Just take a second and guess what that number actually represents. Well, your heart beats roughly 100,000 times every single day. Kind of puts things into perspective, doesn't it? It is unequivocally one of the hardest working organs in your entire body, pumping blood continuously, literally never taking a break, all just to keep you alive. Whether you're sleeping, working, or just sitting here listening to this, your heart is hitting that 100,000 mark day in and day out.
Section 1. The exterior, location, and specs. Let's dive right into this.
So I want you to do something for me right now. Hold up your hand and just make a clenched fist. That right there, that is about the actual size of your heart. It's a muscular organ located right in the center of your chest, just sitting slightly toward the left side. And despite all its power, this incredibly hardworking muscle only weighs about 250 to 350 grams in an adult, so it's astonishingly compact for the massive amount of work it does. I mean, it's lightweight, it's the size of your fist, and yet it absolutely powers everything you do.
Moving on to Section 2, the architecture, chambers, and valves.
Okay, so the heart is divided into exactly 4 chambers. You've got the upper chambers, the right and left atria, and these are designed to receive incoming blood. Then right below them, you have the lower chambers, the right and left ventricles. So if the upper chambers are the receiving rooms, these lower chambers forcefully pump blood out of the heart. And here is a phenomenal detail you definitely want to take away from this. The left ventricle has the thickest muscle of them all. Why? Well, because while the right ventricle just has to pump blood right next door to the lungs, that left ventricle has the absolute monumental task of pumping blood to your entire body. It literally needs more muscle to get the job done.
Now, what's really interesting here is how the heart keeps all this traffic flowing seamlessly. It relies on 4 one-way valves: the tricuspid, the pulmonary, the mitral, and the aortic valve. With every single one of those 100,000 heartbeats we talked about earlier, these 4 doors open and close. Their sole purpose? To keep blood flowing in only one direction. They snapshot right after the blood passes through, completely preventing any backward flow. It's just a flawless, highly precise one-way system.
Section 3, the journey, the path of blood flow.
This dynamic action sequence is literally what gives you life every single second. Here's how it plays out. Step 1. Oxygen-poor blood returning from your body enters the right atrium. It then drops down into the right ventricle, which pumps it straight out to the lungs. Why? To pick up a fresh supply of oxygen, of course. Step 2. Now we've got oxygen-rich blood. It returns from the lungs and enters the left atrium, flowing down into our heavy-lifting chamber, the left ventricle. And Step 3. That highly muscular left ventricle forcefully pumps this oxygen-rich blood through a massive vessel called the aorta, sending it out to supply oxygen and nutrients to your entire body. So oxygen-poor comes in the right side and goes to the lungs. Oxygen-rich comes in the left side and goes to the body. It's an incredibly elegant, continuous loop.
But wait, what about the heart itself? Let's look at Section 4, self-care, the heart's blood supply.
Here is a bit of a plot twist for you. The heart works so incredibly hard pumping blood for the body that it actually needs its own dedicated supply to survive. Enter the coronary arteries. These blood vessels wrap around the outside of the heart, delivering oxygen and nutrients directly to the heart muscle itself. You see, it can't just absorb oxygen from the blood sitting inside its pumping chambers. If the heart doesn't care for itself first through these coronary arteries, well, it absolutely can't care for the rest of your body.
So grasping this fundamental anatomy, the location, the 4 chambers, the 4 valves, and the coronary arteries, this is your essential first step toward mastering cardiovascular medicine. It really forms the foundation for everything else you're going to learn in this field. And hey, if you want to keep building on this foundation, you can keep learning with the Auscultation World App. It's a fantastic tool where cardiovascular medicine becomes simple, practical, and honestly, super easy to remember.
So you've seen the specs, you know the architecture, you've traced that life-giving journey of blood, and you know the engine inside and out. The only question left is, now that you know how it pumps, are you ready to master cardiovascular medicine? Thanks so much for joining me for this explainer today.